Cochlear implants are widely considered to be the greatest neural implant of a generation. They give access to sound to people that otherwise would have had none at all, but there's also a danger that we mistake them as a complete cure for deafness. They're not. And whilst the brain is amazing at putting together information and filling in the gaps so that you can understand a complete verbal sentence, for example, delivering sound to the ears digitally and electrically will obviously never be able to fully, faithfully replicate the subtleties of natural acoustic sound. Now, some recipients do experience amazing results, but that can never be our baseline expectation. And for that reason, whenever someone wants to hear better, we will always exhaust the option of conventional hearing aids and other types of implants first, that work on the basis of amplifying the volume of natural sound reaching the ear. Now, as time has gone by, we've become better at understanding where that tipping point is between leaning on conventional hearing aid or moving to cochlear implants, in terms of which is going to give the better speech understanding. But this can now lead to some very difficult dilemmas, and one of those is in the case of professional musicians. Now, take a look at an audiogram like this. On the x-axis, you've got pitch from low pitch to high pitch, and on the y-axis, you've got hearing level from perfect hearing at the top to no hearing at all at the bottom. And the speech frequencies are in the middle, so it's clear that this person, as an example, will be missing a lot of speech information that could be better delivered by a cochlear implant. But look at those low frequencies. These are going to be particularly valuable to someone who relies on the subtleties of sound or plays in an orchestra, for example, where accurate identification of the location of sound is going to be very important. The low frequencies really contribute to that skill. The surgery itself, to insert an electrode into the cochlea, brings the general expectation that this will diminish the natural remaining hearing that's left here. And so sometimes we're faced with a difficult decision on a potential trade-off of the remaining authentic natural hearing in order to achieve that better verbal communication that a cochlear implant will give. And so the recognition on the value of natural hearing preservation during cochlear implant surgery has led to a lot of focus in this area in the past few years. What about if we can provide the benefits of cochlear implant hearing whilst also preserving that valuable natural low frequency hearing? Well, in actual fact, this is now possible in many cases. Through softer electrode design, slower electrode insertion during the operation, and the use of steroids, we're finding that it actually is possible to preserve natural hearing in a number of cases. And we've actually published our own data on this, which you can find online. The challenge that remains, though, is that we and many other units internationally aren't able to yet effectively predict which patients will have their natural hearing preserved. But as we get better at this, it opens up opportunity for people with different individual hearing needs who are considering making that big step over to becoming a cochlear implant user.